All right. Hello, everyone. Thank you for joining us today. We're coming to you from the McMaster Health Forum at McMaster University in Hamilton, Ontario. This is our first of our spring webinars where we have the opportunity for our Queen Elizabeth Scholars to present on the work that they did while they were on their internships or scholarships abroad. Just a quick agenda for you. I'll tell you a little bit about the McMaster Health Forum and the Queen Elizabeth Scholarship Program, and then I'll introduce you to our presenter today, who's Kristy You. She'll be presenting on work that she did while she was in South Africa, and then we'll have an opportunity at the end for everybody to ask questions. Those of you that are in the room can ask verbally, and those of you who are joining us online, please use the chat box and type in your questions. So the McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, prepare action-oriented leaders in an effort to be an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between Rideau Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the McMaster Health Forum, our Queen Elizabeth Scholarship Program is entitled Strengthening Health Systems. Our scholars will not only contribute to strengthening health systems, but become part of our large and growing network of health system leaders. We currently have two cohorts of Queen Elizabeth Scholars. In the first cohort, you'll see that we had 13 scholars, a variety of incoming scholars, and outgoing interns, of which Kristy was an outgoing intern. We are currently organizing our second cohort. This group is a little bit larger than our first one, and these people will be traveling either the summer of 2017 or the fall of 2017. So I'd like to introduce you now to our speaker for today. Kristy is an undergraduate student in the Bachelor of Health Sciences program at McMaster University. She has an interest in the social determinants of health with a specific focus on barriers to access to health services, which came from a previous trip she took to the Dominican Republic, where she collected data for her undergraduate thesis. In terms of her work in South Africa, Kristy is excited to see how her work will inform policymakers of the best available research evidence on integration of care initiatives and assist in initiating future research to bridge the knowledge gap in current literature. So, without further ado, I'd like to turn it over to Kristy for the remainder of the presentation. Kristy?
Thank you, James. So, my presentation today will be talking about my internship that I did over October of last year until January of this year, where I traveled to Cape Town, South Africa to work on a project that consists of doing a scoping review on integration of care for hypertension and diabetes. Okay, so just a very quick rundown of what I'll be presenting today. First, I'll talk a little bit about my internship at the Center of Evidence-Based Healthcare, more specifically about my QES project, a little bit more about the overarching, how it is a part of the collaboration of evidence-based healthcare project that is being conducted in South Africa, and a little bit more about the scoping review process, because that was the main goal of my project was to conduct a scoping review at South Africa. My post-internship experience, so what I'm currently doing now, and then to wrap up, to talk just a little bit about outside academics and my internship, what I did in South Africa. Okay, so it's a little ways away from Canada, so I traveled with 4 different flights, a little under 17,000 kilometers, and just over 28 hours. I traveled from Toronto to London, transferred to Cairo, to Johannesburg, and then finally I reached Cape Town, South Africa. So this is a picture of the end of year party that was conducted with part of my office. So I worked at the Center of Evidence-Based Healthcare, which is a part of Stellenbosch University located in Cape Town, South Africa, and the core activities that's conducted in the center included conducting research through, conducting and supporting systematic reviews and primary research. So this is the main part that I participated in because I was doing the scoping review. They also did teaching healthcare professionals and stakeholders in terms of, translating the knowledge that they've gained from evidence and research, and then teaching them how to apply them to policy making. So unfortunately, I didn't really get to participate in a lot of this section of the activities, but I was fortunate enough to get invited by my supervisor, Dr. Karen Young, to one of the conference where she met with a lot of stakeholders in the government, and she taught them a little bit more about systematic reviews and what it is, how they conduct it, and so I got to see a little bit of interaction between the center and, I guess, government officials in terms of sharing ideas, in terms of bringing research and translating it into policymaking. And then lastly, they also do, of course, knowledge translation, and that is what, I guess, the end of my project will aim to do, and I'll talk a little bit more about later. Okay, so my project is a part of a larger initiative that is called the Collaboration for Evidence-Based Healthcare and Public Health, or also known as CBHA+. And on the left side of the screen is a map of the different places that, or different institutions that also work within the collaboration. So the main focus of this collaboration is to support African health systems to work in evidence-based ways through the promotion of best available evidence in clinical health care and individual patient care, and the fostering of South-South as well as North-South cooperation. So as you can see, I don't know if the pointer works. Okay, it does. So I was in Cape Town, South Africa, so Stellenbosch University is one of the institutions that work in the collaboration. So this whole project started off with the Global Burden of Disease report that was released in 2015. And from that report, we saw that there was an increase of premature deaths that were caused by non-communicable diseases in sub-Saharan Africa. So with that in mind, we knew that the collaboration wanted to start shifting the focus from communicable disease to non-communicable diseases. So it was part of our project to help in that research task. So they all gathered together in 2014, and they developed a variety of priority questions and research tasks that would be divided up within the institution and will be shared among us so that we can accomplish the goal. So here are the list of research tasks that they established as a team and prioritized them. So they mainly focused on hypertension and diabetes as non-communicable diseases, but as you can see, for task number 4, they also looked at road traffic injury because they deemed that's also one of the priorities that they wanted to look more into research-wise. So for tasks 1 to 3, they focused on hypertension, diabetes, and they looked at screening approaches, looked at integrated models of healthcare delivery, which is more about my project that I will talk about later, and as well they wanted to look into population-level interventions in prevention. And then number 4, as I talked about earlier, they looked at something separately, very different, and that was how to improve the implementation of road traffic injury prevention interventions. And step 5, I guess task number 5, kind of goes underneath task number 1 to 4 as well, because all of us were using the promotion of an integrated, rigorous methodological approach across all the research tasks and activities. So I guess a little bit of a timeline-wise, this project started in the first quarter of 2016, and this would hopefully end in the fourth quarter of 2020, so it will last for 5 years. So a little bit more about my project. It is more focused on research task number 2, so again, using evidence-informed policies and practices on integrated models of healthcare delivery for hypertension and diabetes in sub-Saharan Africa. So the main goal of my project is to, or not my project, the main goal of the project in general is to conduct a systematic review. But before we can do that, we kind of want to see what the literature is already out there, which is my task for my internship, which is conducting a scoping review. So we understand a little bit more of the research is already out there that's already been conducted, so we can see if there are any knowledge gaps that needs to be filled in or that we're interested in, so that we can inform the next step in formulating research questions for the eventual systematic review. Okay, so I guess a very general rundown of how the scoping review process goes. So first I was setting the scope. Because integration of healthcare is a relatively new term, so we found out that there are a lot of different studies, a lot of different researchers that define the term a little differently. So for us to even start the process of conducting the scoping review, we really need to find out what we define the term as. So I spent the first week there just looking at how other people define, in previous research, how they define integration of healthcare, and then we picked out the pieces that we thought would be useful for our research, and then we kind of defined integration of healthcare delivery for our own process. Next was the protocol. So that was, I had to write up a protocol before we even started the research, just to give us a really good outline of how the next couple of weeks would look like by the time I finished the project. And then afterwards, I did a literature search, and we went through databases such as Medline, Embase, Health Evidence, and the Cochrane Library to really review all the articles and citations that might meet our inclusion criteria. And then I did the data extraction by myself, but it was double-checked by one of the, the researcher on the program as well, Anke. So she would double-check my work after I'm done with the data extraction. And then the next part was robust assessment. So this is a risk of bias assessment for systematic reviews. And this one, both Anke and I, we did it in an independent and duplicate manner so that we can ensure that if there are any discrepancies, we can come back and discuss and talk about it. And finally, I'm in the last stage where I'm writing up the paper. So a little bit about the robust assessment. It is short for risk of bias in systematic review. And this was created by the School of Social and Community Medicine in University of Bristol. And there are 4 main domains. So first, study eligibility criteria. Second was identification and selection of studies. Third was data collection and study appraisal. And fourth was synthesis and findings. So within each of the domains, there are usually 5 or 6 leading questions where we would have to answer using a range of scales. So from yes, probably no, no, and not applicable. And from that, we would judge each domain in terms of the risk of bias. Is it high? Is it low? And then using all that, we would sum it up and have an overall judgment for the entire systematic review. So on the left side of the screen is just one of the phases of the robust assessment. So that was my main project, but I also got to work on a side project. And we decided to compare the different quality assessment tools because, as we know, that robust is not the only quality assessment tool that is used for systematic review. So it would be very interesting for me to compare it to MSTAR, one of the more commonly used tools. And at the same time, we wanted to also compare it to a reporting tool, so the PRISMA checklist. So this is another side project that was tacked along to my main scoping review. So I guess now I can talk a little bit about more of what I'm doing post-internship. So even though my time in South Africa has ended, I came back to Canada, but I'm actually still doing a lot of things that were related to the internship, and I brought over a lot of the skills and knowledge I learned, and so I wanted to talk a little bit about how I'm applying that now here. So I am still in contact with the team at the Center of Evidence-Based Healthcare. I chat with both Karen and Anke on a frequent basis where we're still working on the scoping review and also as well as the side project in terms of the comparison of the quality assessment tools. And as well, I'm working at the Program of Evidence-Based Care, which is located here at McMaster University. And I was actually very coincidentally placed on the task of, trying out the new agreed-to guideline instrument. So this is a little bit similar to, the robust tool that I was using, but instead this is for a guideline instrument. So it's very interesting for me to really see the comparison between what the different tools are, even though they I guess they're aimed at determining the quality or assessing the quality of different things. But I found out that guidelines are actually very similar to systematic reviews. It's basically a systematic review, but in addition, they also have a section for clinical recommendations. So that is an, I guess, additional step that a lot of the agreed-to instrument has in terms of its component that both the Robis and MSTAR tools didn't have. So it's just really interesting for me to see how the two sets of tools differ in terms of, and also how they're similar. And lastly, I'm also working here at the Health Forum, and I also got a chance to assist on another scoping review, which is, again, coincidentally very similar to the project that I did back in South Africa, where this time we're just looking at general collaborative care models for treating mental health and physical conditions. So again, very relevant to the work that I did back there, and now how I'm bringing those skills here back home. So in addition to just, I guess, working on my internship, I also got to travel a little bit, so I thought it would be a good time to showcase a little bit of how South Africa looks like. I got the chance to go to Boulder Beach, where there was just an amazing amount of penguins. And the photo in the middle is the Old Biscuit Mill, where they hold, every week they have a Saturday market called the Neighbor Goods Market. And then down here we have another beautiful nature scene. It was sunset at Chapman's Peak. And then here I got to do a fair bit of climbing myself, and this one was in Table Mountain. And then finally I also got to learn a bit more about the history of Cape Town, and this was taken at a walking tour that I did, which is very affordable and very accessible for a lot of people and tourists. And of course, I feel like I definitely have to mention a lot of the people that I have to thank and are very grateful for making my trip this great. So even though I was in Stellenbosch University, I met a lot of the Stelly students on a camping trip. And then the picture on the right, this is the lovely group of people that I got to work at the Center of Evidence-Based Healthcare, and they held a farewell party for me. And here is another picture of Table Mountain. And of course, there's a lot of hikes going on. So this was a very early Saturday morning hike that I went up to Devil's Peak. And then finally, I also got to spend Christmas. So this is the lovely Esther's family, where I got to spend Christmas with them. So thank you. I also have a little blog if you guys like to check it out. It has a little bit of like my experiences, I guess, more into my time in South Africa. Credits for some of the photographs I used in the presentation and references.
Great. Thank you very much, Kristy. That was wonderful. So we'll pause now and see if anybody has any questions. So anybody in the room, if you have any questions, feel free to put your hand up. If you are online, then please type your question in the chat box, and I will read it off for those on the call and in the room. While we're waiting, Kristy, to see if anybody wants to ask a question, I will ask a question or two to get things rolling. So lots of ways that we can go here, question-wise. I guess, in terms of the topic of the scoping review, which is diabetes and hypertension, you're looking for gaps in evidence. So where was the biggest gap in evidence that you found when you did the scoping review?
I think that there's a lot of gaps in evidence, because a lot of the systematic reviews that we found were mostly just focused on the comorbidities of diabetes and depression. So basically everything else we haven't really found anything of. So we only found that there's one solid, I guess, field that people were really focusing on in terms of looking at collaborative care models, and that's only for diabetes and depression. So I feel like everything else still needs to be explored further in this collaborative care model delivery.
Great, thank you. So we have a question from one of our people joining us online, so I will read it for everybody else. So it says, "Hi Kristy, great presentation. I just wanted to know more about the experience in general. Did you experience any difficulties when commencing your evidence-based policy research, and how did you go about finding solutions?
I think the greatest difficulty was that I was very much leading the scoping review by myself. Even though I had a lot of support from both Taryn and Anka, I felt like this was something that was relatively new for me to start from, the start of the project, from the protocol to now I'm doing the final write-up. I don't think I've ever done such a big task or like a review all by myself. But in terms of finding solutions, it was really nice because I had weekly meetings with both Anka and Taryn, and I could also drop in by the office at any time. So it was really great in terms that if I had any problems, any questions in terms of things I wasn't sure about, I always had someone to find a solution or an answer to, and then I could carry on my work with it pretty smoothly. I don't really have to wait around until the next time I could talk to my supervisors again. The way that the center was set up, it was very easy for me to do my work within the set time from the office. So I was in there from 7:30 till 4, so I could do whatever I need to work there, but at the same time, I could also use the opportunity to really ask any questions I have in terms of the project or just in terms of anything in general.
Great, thank you, and thank you for the question online. So nobody in the room seems to be wanting to ask any questions at the moment, so I'll ask another one since we'll keep the ball rolling a little bit. So you're doing a side project that's comparing different tools, so maybe, we here in the Health Forum traditionally use MSTAR, so maybe just a quick, what's the big difference you found between using MSTAR and using Robust?
I think the biggest difference is how in-depth into the details that the two go into. So MSTAR is only consisted of 11 questions, whereas Robust, I think, when you add up all the domains, is around 23 questions. So it's significantly more in-depth and more details into each of the domain. And I guess in terms of the number of discrepancy, you also see more discrepancy for the Robust because the scale interval they have a lot more, intervals within the scale. So you range from like yes to probably no, and non-applicable, whereas MSTAR is just a very simple like yes, no, non-applicable, can't answer. So a lot of the times I find that both Anka and we sometimes differ between just like, a probably yes and a probably no, and how do you really find that distinction, because a lot of it comes from experience and how you really interpret the question or how you interpret the scale. So I guess that's the biggest difference, coming in as a new learner in learning the tool.
Okay. Great, thank you. So we have another question from someone joining us online. So the question is, if you could pick one thing that you did for pre-departure that prepared you for your experience abroad, what would it be?
It would be definitely learning more about, the difference between like the different quality assessment tools. So I didn't really have a lot of background or experience in this, and I guess it's just pretty unique to my project, but that's how I ended up taking a lot of the direction of our project in terms of looking at risk of bias and quality assessment tools and such things like that. So it would be nice to have more of a background on it rather than just jumping in like head first and not really understanding the tools and trying to figure it out myself. So I think having a little bit more background, or just generally understanding maybe what the process of a scoping review might entail. Like, again, I didn't know that going in, so I kind of have to figure out things on the way. Everything worked out at the end, but it'll be kind of nice to know now that I'm looking back in hindsight.
And, as you prepare for a trip like that, so you were gone from October into January, so you were there over holidays and those kinds of things. So as you're preparing for going away for 3 months, what did you find, now that you can look back, it's like, well, I'm really glad that I did this or that I looked into this before I left. So what was helpful to you in that regard?
Well, looking back in hindsight, I'm a little bit disappointed that I didn't extend the time I was there, because it was basically from start till end. I was there for the internship. I got a little break in the middle for Christmas, but because I didn't really plan ahead, I just stayed within Cape Town, even though there's so much of South Africa to explore. Like a lot of people would end up saying that, you should have gone up to like Namibia. It would be like a short, nice road trip, but if you don't look into things like that you have to plan ahead of time, you can't really do a lot of major trips and things like that. But I still really enjoyed my time in Cape Town just because it's a very tourist area. So I could do a lot of day trips. I didn't really need any planning ahead. It was very much spontaneous. You just hop on a bus and then you go out to sightsee for a bit. So it worked out at the end. But again, if you really are determined to see more of the country, definitely plan ahead.
So that's good advice. So embrace the trip as a trip. As
Yeah.
you're in that part of the world, you might as well spend a little time there.
Yeah, for sure.
Perfect. So helpful advice about planning ahead and looking at what you can do, where you're going. So I guess the question that it's a logical next question is what did you really enjoy? What experience outside of your work environment did you like? Oh, this is what I did in South Africa. What's the first thing that you tell people?
I would definitely say climbing. So I started climbing around 2 years ago, but unfortunately Ontario is pretty flat, so there's not a lot of outdoor places to climb. So South Africa was definitely a climber's paradise for me. And because I didn't get to live in Stellenbosch as I initially thought, so I didn't get to meet a lot of peers and students around my age, and climbing was a way for me to really socialize outside of the workplace environment. So I'm really glad I got to do that because I ended up doing a lot of camping trips, going away for the weekend, just seeing different places, going up mountains, just seeing all the beautiful places that South Africa had to offer.
So we have another question for somebody online. So someone who clearly knows a little bit of something about the forum. So wanting to know if you used health system evidence, a repository of research knowledge, while you were abroad for your scoping review, or if so, yes, and if not, what other databases did you use?
So yes, I actually did use health evidence. So, and we also use, I guess, Cochrane Library, which is very, I guess, conventional when you're looking at systematic reviews, and of course Embase and Medline. So those were the 4 databases that we covered. Yeah.
Okay, great. And in terms of the project, so scoping review, they're looking for gaps of literature and hypertension and diabetes. So where to now? So what process are you at in the writing of the papers, and where do you see the project going after this?
So we actually finished compiling the the results a while ago, but it was just very hard to, I guess, compile it in a way where we can make sense of it because each paper talked about different outcomes. They weren't very established in a way that we can compare all the papers across the board. So we took some time in terms of organizing the results so that it's something that is more comprehensible for us. So I'm in the stage where we're starting to write up the discussion to really look at what do these results mean to us now that we found all of this, and then hopefully find a gap or direction that we're really interested in so that it can help us formulate a research question for the next step in the overall arching project, which is writing up a systematic review using, I guess, knowledge that we have from the scoping review.
Great. And how, thinking about health systems now, so you're working in the health systems of South Africa, which is actually the project as a whole is looking at multiple countries in Africa. Mm-hmm. So how well does this work translate back to Canada, and does it inform your knowledge of the Canadian system in any way?
It really, because a lot of the systematic reviews that we found and included in the study are actually based in North America. So it really shows how privileged we are as, I guess, Canada or our health system, how we're able to invest a lot of the research and resources into looking into more collaborative care models, which is, I guess, a relatively new field. Not a lot of research has been done in it. So we are this research kind of showed us that we were leading in this field. So it really, again, because I'm also assisting in a similar scoping review in the collaborative model for the Health Forum, it just shows how we are really leading research in the field. And I think it's more so how we can continue to be a leader in this field that is really interesting to me. I don't really see in terms of bringing anything back because I don't know, a lot of the research I did there was actually based on the research that was done in North America, if that makes sense.
Right, yeah, it makes absolute sense, so thank you. Okay, so we have two questions from the room. So the first one, we'll start off with the first question that was asked. So the question was basically a comparison between the McMaster Health Forum, where we are now, and where you visited in South Africa, which is the Center for Evidence-Based Healthcare. So what are the similarities and differences between those two entities in terms of the work that they do and how they're structured?
So I guess the biggest similarity I see is in terms of the research. Both of the centers really try to use evidence-based research to really inform policymakers in different decision-making processes within the health systems. But one thing that I find unique about the McMaster Health Forum is that you guys have a lot of citizen panels or stakeholder dialogues that was not really a part of the focus of the Center for Evidence-Based Healthcare in South Africa. So I think those are the main similarities and differences I see.
Okay, and the second part of the question was about the context of the work that they do and how, I guess, closely tied they are to policy making. So, not to spend time talking about the forums, but maybe talking about the team in South Africa and how closely linked they are to decision makers and policy makers, and how they put the context of the work that they do into policy itself. So, do you know how that working goes on in South Africa?
I'm not too familiar in the area, but as I mentioned previously, I was fortunate enough to be invited to one of the conferences that Taryn taught a very short course on systematic review. So they definitely do, and she also opened up like a question and answer period where the different policymakers and stakeholders got to ask her a lot of questions about more on the research side of things and how they could integrate that into their policy making. So I know that is definitely something that they're working hand in hand, probably more so as the educational side of things. But in terms of research, I'm not entirely sure, so I didn't want to really go outside and say something that I'm not entirely sure about in terms of how the two is informed. I could only talk about the CBHA Plus collaboration because that was something I worked on. And from a brief understanding, it is that the various policymakers in all the countries that are part of that collaboration came together, saw the report, and realized that, there are a lot of people who are being diagnosed with hypertension and diabetes now, and we're also very interested at road injuries. So, these are things that we want to look at. So they talked to all these institutions that are part of the collaboration and said that, these are the research areas that we want you guys to look at. And then they ended up dividing up into separate teams and then looking at different research topics and how they would go about, going to conduct the research. And I think that they come together once in a while to really update each other on the progress of each other's research in terms of collaborative team effort, but I'm not entirely sure on anything else.
No, fair enough, absolutely. So looking around the room, I think I see some smiling and contented faces. I'll take one more call online. If anybody has any questions, feel free to type it in the chat box, but I think we're winding to a close. I think everybody feels quite good about what you've done here, Kristy, so thank you very much for taking the time and presenting your work. I will point out to everybody on the screen, that first link is information about our scholarship program if you're interested in applying. The second link is our Insights page, which is where you'll find links to these webinars, future ones, and links to past webinars, as well as blogs, which leads us into the third link, which is our Queen Elizabeth Scholars blog page. So Kristy had her own personal blog page that she had posted on her screen there, but we also have one for our scholars, and she'll be writing a blog for us specific to her scholarship work. And otherwise, thank you very much, Kristy, and thank you everybody for joining us, and we will see everybody again soon.
Thank you.
Okay, bye-bye.